All right. Hello and welcome. Thank you so much for joining us today. We'll be discussing Skin Health 101. And before we go ahead and introduce our lovely host, I'm going to jump into a few housekeeping items. So, first off, all attendees are going to be in listen only mode for the duration of the webinar. Also, if you guys have any questions, comments, please go ahead and use the chat box. I believe it's located up in the top right-hand corner of the webinar screen. And if you're looking for the PowerPoint and the slides, that can be found in the resources section at the top right of the webinar screen as well. All right, so now I'm going to go ahead and introduce our lovely webinar presenter here today, Riley Summers. She is the physician assistant over at Marathon Health at the Olivia. So a little bit about her. She is an IU undergraduate. She is also has her master's in physician assistant studies from Butler University and is a practicing physician assistant since 2016. So she's also an Indianapolis native, so woohoo. Currently residing in Carmel with her husband and toddler son, Henry. And since it is May, a little fun fact here, she was the 2011 500 Festival Queen.
Yeah,
so
relevance there.
Yes, so how fun. We're excited to have her today, and we're so appreciative that she is here to discuss Skin Health 101 and everything that we need to know about how to take care of our skin. So without further ado, I will turn it over to Riley here, and she's going to give us the lowdown on how to take care of our skin.
Awesome. Thank you so much. All right, guys, a couple things. Who is Marathon Health? This is kind of the fine print. Essentially, we are an employer-based healthcare corporation that does great primary care. We have clinics here in the Indianapolis area, but we also have clinics across the United States now. And then just kind of for my disclaimer, just remember this is just educational. If you do have a question or concern, please reach out to your primary care or go see a dermatology specialist. So, all right, let's get started. So skin is a complaint that I see so much of, especially during the summertime. So first of all, let's kind of just start with some general skin education. Skin is our body's largest organ. So it kind of protects us from external stressors, protects us from infection, things like that. A quick anatomy overview is that we have to have 3 layers of the skin. So your epidermis is the skin that we see on the outside here. Dermis is just a little bit underneath. And then that hypodermis is the second layer in, which kind of has the blood vessels and things like that. So, all right. A lot of my patients will ask me, tell me how, what's the best skincare? What should I be doing? So a quick overview of this, because I know that we see a lot on the internet about how to take care of our skin, and it doesn't have to be complicated. So a gentle cleanser can be great. All you need to do is make sure that this big organ, our skin, is nice and clean and that we're keeping infection out of it. A moisturizer can also help with that skin barrier. I prefer, as we will see later in this webinar, that SPF is always going to be a really good daytime option. There's a lot of combo products over the counter. As far as acne goes, depending on what you need and what your skin can tolerate, there's some over-the-counter medications like a topical benzoyl peroxide. There's also some sulfur-derived medications that work really well too. In my bottom right-hand corner, you can see a medicine called Differin Gel. That's also a retinol that's over the counter. Retinol kind of helps regenerate those skin cells. So in addition to acne, it can also help with fine lines and wrinkles. The big thing about retinol is that we only want to do it at nighttime. And it can kind of be intense, so we like to taper onto it a little bit, even our over-the-counters. As far as pigment and color, oftentimes patients will ask about sunspots. Vitamin C, that's a really important one. You can utilize that. My little kind of annotation there about it being in an airtight container without getting too nerdy is that vitamin C actually oxidizes when it's exposed to the air. So an airtight container is going to be best because then you don't have the air that then oxidizes it and then changes its chemical formulation, which can actually create more harm. So just some over-the-counter skincare brands that I like. You can get these at Target, Walmart, CVS, Amazon. They're all really great options for you. Summer skin conditions. So like I said, we're going to focus on kind of skin cancer today, but I would be remiss if I didn't talk about some of the things that I see in my clinic during the summertime. So Itching. Itching is a big one. We're outside, we're going to have more bug bites, we're going to have rashes, we're going to have things that irritate that skin layer. Plants, irritants, even animals that have kind of rubbed in, maybe a poison ivy and then they come snuggle up on you. So if you have an itchy rash, a couple places to start. An over-the-counter hydrocortisone, that's going to be helpful to help decrease the itchiness of the rash, some of the angriness. Calamine lotion can also be helpful. A Zyrtec, Allegra, Claritin, one of those over-the-counter antihistamine medications that can decrease the itching as well. And then sometimes if we're just generally irritated, an oatmeal bath can be helpful. My trick, now that I'm a mama and have had to do oatmeal baths for my baby, if you get a pantyhose and you cut it so that you have like the foot of the pantyhose,
Yes.
put the oatmeal in that and tie it off. So it's almost like a bath bomb, like in the pantyhose.
Okay.
Then you can let that kind of simmer in the bath, and then you're not physically cleaning out oatmeal from your bathtub.
That's good, because that is a mess, isn't it?
It's very messy. It'll get you calling your local plumber for sure. So if you want to put it in a little pantyhose, that's easy. If you're still itching, even after some over-the-counter stuff, just remember you might need something that's a little bit stronger, a topical or an oral medication. So pop in with your provider so they can take a peek at you too. Lacerations or cuts, we're more active, we're outside, we're doing yard work. Biggest thing is going to be to keep that area clean and dry. A little tip from the medical realm, Neosporin has been advertised heavily as like a really good topical. Actually, we're kind of sensitive to one of the ingredients in Neosporin. So it's kind of like a 2 steps forward, 1 step backwards when we use that medicine. So we actually tend to recommend bacitracin for patients. It's just got that one ingredient and that's really all you need. And then obviously if you did get a cut or a bite or something like that, making sure your tetanus vaccine is up to date and you're nice and protected there. Finally, another summer skin condition that I hope is a moot point after this conversation we have today is sunburn. It happens. We were just talking about it before this webinar started. Some kind of fun, cool tip, kind of play on words there, is that you can put your aloe and after sun treatment in the refrigerator. So then when you put it on, it actually feels kind of nice. It's a little jarring because your skin's sensitive, but it does kind of cool it down a little bit more. So, and just remember, the best treatment for any type of sunburn is going to be prevention. All right, down to the nitty gritty and kind of what I'm most passionate about. Obviously, I love talking about how to take care of our skin and some summer things, but skin cancer is definitely something that I preach to my patients, and I hope that our webinar guests also understand the importance of. So the basic rudimentary definition of any type of cancer is an uncontrolled growth of abnormal cells. Skin cancer has 3 different types of skin cancer. It's squamous cell, basal cell, and then melanoma. Basal cell is going to be our most common form. Here's a couple pictures of it. Most often on sun exposed areas. I mean, our whole body is exposed to sun, but I think about my husband, who's a golfer, face, scalp, ears, all of those areas. This definition of a basal cell carcinoma, it's going to look like, if we have a board exam question that's going to be a basal cell, it's going to be a pearly, kind of raised, you can kind of see on the top picture, it's a raised, almost has like a pearly look to it. The bottom picture, you can maybe see a little bit of the blood vessels. So the fancy word is going to be a raised pearly bump. It's going to be pinkish, and you might notice something called telangiectasias. Those are really tiny little spider veins that you can kind of see throughout the bump. So basal cell is going to be that pearly-like mass that you notice. Squamous cell on this lovely ear that we've got here, again, most often appeared in sun-exposed areas, face, arms, chest, back, all of that. This squamous cell is going to be more like a scaly patch. Think squamous and scaly kind of go together. It's going to be something that is kind of reopening and not healing very well. So you're going to be like, man, I've had this lesion for a little while and I would expect it to heal, but it keeps kind of getting itchy or scratchy and bleeding a little bit. So think about it as something that is kind of red, maybe a little elevated, but just doesn't heal very well. In general, patients come to me and they're like, well, what should I be looking for any type of my moles? Anything that's changing, anything that I call that ugly duckling. So any mole that you're like, this looks different than other ones that I have on my body, or this is acting different, it's not healing, or it's raised, or anything like that, that is when you need to come in and see your provider. I think all providers out there would much rather have a patient come in and say, hey, can you take a peek at this, than ignore it.
Right.
Before we get to melanoma, I'll just pop to the previous slide, just so patients know, and during this webinar, the squamous cell and the basal cell carcinomas, they are ones that are classically kind of stay right where they're at. So they don't metastasize or go through the body. Oftentimes we can have a treatment of a surgical removal or a removal in the office. There's some topical creams. So although they are cancerous and concerning, treatment-wise is pretty easy. So the next is the big kahuna, which is melanoma. It's our most serious form, and obviously, can develop from an existing mole. So that's where that ugly duckling, if something changes or looks different. So it can go from something existing, or it can be a brand new one. It says it appears on all these different areas of the body. It can appear anywhere that you have skin. So ABCDEs of melanoma, that is something as providers that we kind of try to educate patients on. It's an easy kind of mnemonic that we can talk about. So the ABCDEs: A, asymmetrical. If a mole or an area has kind of an odd shape, or you notice an asymmetry to it, that definitely would be something that I would want to take a look at. If the border is jagged, so B stands for border, some moles are going to have a little bit of some kind of waviness around the border. But if you notice something that's a little bit more linear or jagged, definitely have us take a peek. Color, so any irregular color, if you notice within a mole that maybe you have some darker spots or anything like that, come and have us check it out. Diameter is the D of the ABCDEs, bigger than a P or a pencil eraser. That does not mean that you cannot have a melanoma that is smaller than that.
Okay.
But it does mean that if you have a mole that's enlarged, pea-sized, pencil eraser, pretty decent size, that would be something to kind of have us take a peek at too. And then E stands for evolving, and that's kind of just a general, again, that ugly duckling where maybe it's changing, or you've noticed that it doesn't look the same, or your partner or your kid pointed out that something is changing, because kids are very observant.
Yes.
So ABCDEs of melanoma, that is something that we preach to patients. And even if you're not established with the dermatologist and it's a primary care conversation, I make sure that everybody kind of understands that acronym. This is a really, really rare type of melanoma. It is actually something that develops on our nails or our palms. This, again, super rare. I just kind of wanted to put this out there because it also helps us remember that, yes, we have our skin that we think about, but in addition to that, we can also get a melanoma on our fingernails and our toenails. Super, super rare. It's actually the most common form of melanoma in my patients of color. And fun fact, this is actually Bob Marley's cause of death. He had this on his toenail. So there you go.
Wow.
So, as we're all kind of having sandals and, getting pedicures and things like that, make sure you're taking a peek at your toenails and fingernails. And if you notice any abnormal colors, that would definitely be a red flag to just come in and have us check it out. Speaking of kind of my patients of color, here is a scale called the Fitzpatrick scale. This is something that we utilize in medicine more so to just kind of quantify a risk. If you have skin, you are at risk for skin cancer. So that is everyone. Depending on kind of your melanin index is something that we say. So patients that are lighter in color, patients that are darker in color, there is kind of some natural protection there. By no means is anyone fully protected, even my darkest patients of color. But it does have, as you can see, type 1 has the highest risk. That's going to be our really fair-skinned patients, light hair. And then type 6 has the least amount of risk due to their amount of natural melanin. Kind of as we talked about, characteristics that can increase your risk would be natural skin color, lighter skin, lighter hair. If you're somebody that burns easily or freckles easily, lighter skin, lighter hair, family history. That's actually something too, not as much with the basal cell and squamous cell, but with melanoma, there actually can be some family history that genetically can kind of come into play as we are later in life. So kind of a sidebar, when your primary care provider, asks you about family history, we think about, hypertension, diabetes. Skin cancer is actually something that if you have a family history of melanoma, that would be important to let them know as well.
Okay.
Obviously, a personal history of skin cancer, which means that you've probably had some damage in the past, and older age, just because you have more skin cancer and more sun exposure. Okay, so the most common sign of skin cancer is a change in your skin. New growth, a change in an existing mole, or something that's not healing. So again, if you remember one thing, it's my ugly duckling rule. If something is different or changing, please come to see us. A self-examination, I also kind of alluded, I have a lot of patients that come in and they're like, I have this mole on my head that my wife saw, or, someone pointed out to me. I actually have a lot of patients that come in that tell me they have something from their hairdresser. So
interesting.
Self-examination, or if you do have a hairdresser or somebody that is looking at your scalp and they're like, I've never noticed this in the 5 years that I've been doing your hair, please come in and take a peek. Self-examination is great. Having your partner kind of take a look at, the back of our heads and places that we can't see is also something that's helpful too. When in doubt, get it checked out. So whether it's coming to see me over here at the Olivia and Carmel, if you're a Marathon Health member, or seeing your primary care, we would much rather see you than ignore it. All right, protecting our skin. Obviously, as we mentioned, skin cancer, the highest risk is going to be sun exposure. So let's figure out how to protect our skin. The sun has two different types of rays, UVA, which we think is more aging, kind of cosmetic. UVB is more of that burning ray. They're both damaging to your skin. As a child of the 90s, the tanning beds that would say, oh, this one only has this one, so it's not going to be damaging. They're all damaging. Everything damages your skin. Which, speaking of, if you were a tanning bed person like I was, you need to see a dermatologist or your primary care. It is not safe. It wasn't good. We made bad choices back in the day. So there is no safe way to tan. So the rule or the rumor back in the day when it was, if you got your base tan before you went to Florida for spring break, then you'd be better. That's false. So no safe way to tan. We can sunburn, age spots, which just cosmetically people don't like. Wrinkles, again, a more of a cosmetic, but then obviously the big kahuna on the right, that melanoma, skin cancer. So prevention, everybody kind of has an idea of how to utilize sunscreen. 2 tablespoons. I don't need you whipping out a spoon at the beach. I just need you to make sure that you're appropriately covering your skin, entire body, 20 minutes before you're in the water, things like that. Dry skin, reapplying. After you're swimming, even if something does say that it's waterproof, it would be best to just go ahead and reapply, and sweating too. An SPF or a sun protection factor of 30 or higher is recommended. UVA and UVB protection, which kind of incorporates that adjective of broad spectrum. Water resistant versus very water resistant. I don't know, just apply your sunscreen. Even if it says it's water resistant, you do need to continue to reapply. And then my biggest thing, areas like lips, eyelid, and ears. We actually see a lot of skin disease on ears. People forget about that. So get a little stick if you forget about it. And, those little sunscreen sticks can be great. You can just swipe them on your ears and your eyelids and then kind of on your lips too. Those are sensitive areas. A quick thing about sun protection factor, just so that everyone knows kind of what that is. Everyone understands SPF and numbers, but what does that actually mean? So it's kind of a multiplier. So if you are going to be out in the sun and you, without sunscreen, would get burned after 10 minutes, if you use an SPF of 15, it's a 15 multiplier. So you would have 150 minutes until you would get sunburned. So that's kind of an interesting way to think about it. It's just a multiplier of how it protects our skin. Everyone's going to be a little different though, because you might burn in 10 minutes and girl, I burn in about 5. So everyone's a little
right
different.
there with you.
Yeah. So I would
out in the
say,
sun,
30 or higher, that's the best for you. As we kind of are shopping at Target, you're going to see things like a chemical versus a physical sunscreen. Both of them are really good options. They just kind of work in different ways. So physical sunscreen, think about your classic lifeguard with like the zinc on their nose. So physical sunscreen is going to be usually zinc or mineral based. It bounces off. So that kind of creates a bounce for the UVA, UVB rays. Chemical sunscreens actually kind of absorb it and then chemically change it so that it doesn't affect our skin and kind of cause damage. So I get the question all the time, which one's better,
Uh-huh.
Riley? Should I use a physical? Should I use a chemical? And I say, whatever one you use. I don't
Yes.
care. Whichever one you remember to put on, that you
Mhm.
remember to put on specific areas of your body, the ones that you remember to reapply, I don't care. I don't care if it's a spray or a stick or whatever. But as long as you're putting it on and reapplying, that's the best one for you.
Just get it on, it sounds like.
Yes. This is kind of obvious, but obviously stay in the shade, especially during those peak hours.
Yes.
And you know, my webinar guests, perhaps you guys have ever traveled to maybe a country that has really high sun exposure or is higher to the equator. I remember traveling to El Salvador, and everyone stayed in the shade, and I was in the sun. And you know, it's just culturally, people that live in warmer climates understand. So we kind of need to remember that when it's heavy sun outside and those UV indexes are high, it's best to make sure that we're in the shade. Wearing a wide brim hat, and then even there's like the SPF protective clothing. I know for kiddos, they have like the little rash guards that tend to have some SPF protection in them. Local dermatologists will also sell kind of some semi cute, you know, outfits for that. So, but let me tell you, it doesn't matter if it's an ugly outfit. It's protecting us from skin cancer, which is the ugliest thing. So,
you're right.
Wearing sunglasses, again, kind of a really unique and rare thing, kind of like the discoloration on our fingernails. But there is something that's called ocular melanoma. So if we are in the sun, in the water, the rays can kind of pop up off the water and it can damage our eyes. So too much UV can damage those eyes. Also, just kind of protecting the sensitive skin around our eyes too, making sure we're wearing sunscreen and then those sunglasses. Protecting yourself in all weather conditions. So we all think about, obviously, when it's warm outside, that makes us think about the sun. But even if you're, you know, skiing in Colorado or it's cloudy outside, the UV rays can still pass through, and they can still be quite effective and damaging to our skin. So on the early slides, when I talked about a moisturizer with SPF, it's a daily thing. You gotta sunshine, rain like today, gotta have it all. So. Okay, that was a lot. And I think we have some time for questions. So if we have questions, I will happily
We'll double check and see if we have any.
How about you, Rachel? Anything that you learned from the webinar that you had any questions or
Well, you answered my one question about the, you know, what does the SPF stand for? That was my biggest thing.
We all know kind of what it is.
Yeah, I had no idea. And when I think about my kids, I'm always like, okay, I want to put on, I think, just the highest, not because I know why, but just because I'm like, okay, I think more is better, but it is good to know. I think that's something that I learned, what exactly that, you know, that means, and that
multiplier. And you know, kids are tough to get sunscreen on. You know, it's a wrestling match at times.
Yes. Are there any brands of sunscreen that you recommend?
Yeah. Okay. So I personally remember to apply sunscreen pretty diligently, as one would expect. And so I do prefer, for me and my very fair-skinned son, I do prefer more of a mineral sunscreen. My husband prefers the chemical sunscreen because he likes the sprays. It doesn't matter. As far as mineral sunscreen, I really like Blue Lizard. Blue Lizard is a great sunscreen. I think it blends really easily. It's not, sometimes when we have a mineral sunscreen that's zinc based, it can be very chalky and white, which and I feel like, I mean, if we're really caring what we look like, the Blue Lizard doesn't have a huge white cast. It's pretty easy to rub into. Some of the mineral ones, you really have to rub them in. This one, I feel like with my toddler, it's easy to just kind of slap it on there, and I don't have to rub for 5 minutes and get into a little bit of a tussle. I also really like some of the mineral skincare sticks. Those are nice for a kid's face. And even applying, if you can't get that, even applying with a makeup brush is kind of another thing too. Young girls, I've heard, really like to apply their sunscreen with a makeup brush. So that at least gets it on there. So.
Have you heard of, I recently had a neighbor who found this, I think it's called Solar Buddies, and it's, have you seen that?
I have seen it. I haven't bought it or used it, but I've heard of it. Yeah.
So it's like, you basically pour sunscreen into a base, and it's got like a sponge and a roller, and it's supposed to make applying sunscreen, especially to kiddos, very easy. So that was something that I just recently purchased within the last couple of days, actually. So I don't know, like I said, if you utilized it or had anyone that you know of.
Currently, we're still doing okay
Okay,
with like the sticks,
Yep,
but
okay.
I will tell you, if my son can pretend to paint himself, he certainly will. So
Yes.
maybe in the next couple
Maybe an
years,
option,
yeah.
right?
We have another question. Do you have a brand recommendation for a moisturizer with SPF that won't aggravate or cause acne?
Sure, absolutely. So when we add moisture to the skin, sometimes it can be difficult because some of my patients who are a little bit more on the oily kind of side of their skincare, it can create a little bit more oil, which then creates more acne. Personally, over the counter, and I put this in the webinar, I really like the brand La Roche-Posay. It is an over-the-counter brand, but if you're on social media, which makes skincare way more intense than it needs to be, but it's a pretty popular brand in France as well. So French skincare, they know what they're doing over there. So that has come to the United States, and I do like La Roche-Posay. I tend to think that their moisturizer with SPF is very kind of benign, if you will. It doesn't create more oil or acne at all.
Okay. Over the counter, so you can get, where can you,
You
get
can
that?
get it everywhere.
Everywhere?
Target,
Okay.
Walmart, CVS, Walgreens, everything.
Awesome.
Another question. Which type of sunscreens last longer than the other, or are they all created equal?
So hypothetically, they should all be the same. If you have an SPF of 30, it should kind of it's obviously patient dependent on how much you're burning or your likelihood of burning, but it should have the same exponential factor. From more of an anecdotal perspective, I tend to find that mineral sunscreens, because they're or the physical sunscreens, because they're mineral, tend to wipe off, and the water doesn't necessarily wipe it off as easily. When we're spraying a chemical sunscreen on, our body is kind of absorbing that, and it doesn't have the kind of beating and wiping off factor as the mineral ones.
Right. Okay.
Yeah. So
Another question. What foods promote good skin health?
Ooh, that's good. Okay, so anti-inflammatory foods are going to be good. I'm going to tell you, there's like internet trends of dairy-free and gluten-free and all of those things. And if you are not having issues with your skin, if it ain't broke, don't fix it. So sometimes you can have a little bit more of an inflammatory diet, but if you're able to have your normal whole milk latte every morning and your skin is fine, then I wouldn't change it. But there are some, obviously fruits and veggies are going to be the best for us. Lots of water intake, so fluid can definitely help. Water is very good for our skin. And then as far as fruits and veggies go, are high antioxidants. So blueberries, the beta carotene and carrots can be good for our skin as well. And just mostly hydration, and then some good antioxidants over the counter.
Wonderful. All right.
Yeah.
Well, that closes out all of the questions and things that we had for today. If you guys have any other further questions that you would like to ask, please go ahead and you can shoot me an email, and we'll make sure that we get those answered for you. But I do want to thank you guys for joining us today, and I want to give a special shout out and thank you to Riley for joining us today as we discussed skin health. Please go ahead and join us next month as we discuss everything that you need to know about short-term and long-term disability. So thank you guys so much. Have a great one. Bye-bye. Bye.